My name is Olusegun Samuel Babatunde. I'm the General Manager of Osun Ambulance Services Agency. Ambulance is an agency of government created a little above 9 years ago to see to taking care of every emergency that is medically related, trauma, road traffic accident, and also take care of referral services across the 3 layers of the health facilities, that is primary, secondary, and tertiary, and to reduce death that results from road traffic accidents. These are the 3 major mandates of this agency when it was created, and by and large, the people of Osun State and people that have passed through Osun State can attest to this agency's performance in those 3 areas that I have enunciated. We have duly spread in the states. We have 30 stations across the states and the highways, all the local governments, and we have been able to take care of all the emergency cases as long as we are called. We have our emergency toll line, emergency line, and we have our call handlers are there to pick calls from the public 24/7. And we have called this line to people severally. Line is 070-8060-1212. The other one is 070-8060-1313. We also have our MTN lines that we just not quite long introduced into it, so that to complement the existing Airtel lines we use. Now the MTN line of 091-36-00033, then 091-36-000-631. Those are the 4 emergency lines that will have, that we join the member of the public to call us in case of any emergency situations, whether trauma or any medically related other medically related emergencies. And asking whether this government is doing well funding the agency, I think the first thing we need to know is that this government is a product of the previous administration, is APC government. So the question of whether the present governor, His Excellency Gov Oyetola, who was a strong part of the last administration, so that question will have been more appropriate if we are seeing different parties coming. I think it's just a continuation of what the last administration started, and you can see how well the governor is consolidating on all the projects that the last administration started. And to me, I feel because presently ambulance is far better than what it used to be. Far better. For instance, under this administration, we have been able to attain 5 to 10 minutes response time. That when you call us anywhere in Osun State, no matter how remote that place is, under 10 minutes, our ambulance will get there. We have been able to train our staff better. There is now regular update training for all our staff, which makes them far better than what they used to be. The ambulances are better equipped now than ever. There's no any of our ambulances that you see that you will not see every equipment that is needed for basic life-saving services. Oxygen, every other thing that you may think you may need. Oxygen is very important. We are not having enough oxygen in the past, but now we have well-equipped ambulances to take care of basic life-saving. Then, in terms of welfare, our staff are better remunerated now. There is 100% increment in their stipend. That is unprecedented. Then when you look at spread, ambulance is better spread. Now, just not quite long, the government just delivered 12 tricycle ambulances to the agencies so that we can distribute. We distributed them four per senatorial district so that the interlands, the remote villages where the normal ambulances cannot get to, the tricycle will be able to get there and take care of them and bring them, to the nearest health facilities to take care of them. Then they complement what the big ambulances are doing. So that these are things that were not there in the past. So you can say this government is consolidating on the existing, programs of the last administration, i.e., ambulance, and is making it better, far better. We have collaborations with private hospitals, and in the past, it used to be that when an ambulance picks a patient after giving first aid, you are looking for the hospital to take the patient to whereby when you get to the government hospital. We were only patronizing government hospital in the past. When you get to one government hospital, you say, there is no space. You go to Ashibawe, there's no space. You go to Lautech, say they are full, or there's nobody to take care of the patient. Now, this governor also gave us approval to partner with Choice Private Hospital so that when we pick a patient, instead of moving, we lost so many patients in the course of transferring them from one hospital to the other. When they reject the patient in this hospital, move to the next, sometimes we lose patients in the ambulance. But now we have partnership with private hospitals that we can take this patient to. And this private hospital, with the understanding that they cannot exploit the patient. It is a basic, charge of insurance, health insurance charge. So you can't use the opportunity to exploit patients. So it's as good as taking the patient to a public hospital, but in the private settings, that is very good. So those are other things that we have done. Now, the biggest achievement the biggest boost to all this is the fact that the governor last year, December, now approved that. We went to him, we discussed with him that sometimes when we pick patients, for instance, the patient is coming from a student, maybe from Repoli or from anywhere, he's just going home. He has just 2,000 naira or 1,000 naira that will take him to his house with him, and he's involved in a road traffic accident. You pick such a patient and take to a public hospital, they say, who is going to pay? This patient is not enrolled under health insurance. Who is going to pay? The patient is even unconscious. You can't even call the parents, can't call anybody. And sometimes when we take the patient to the hospital, who pays? And the governor, in his magnanimity, also approved that every patient that is involved in road traffic accident or any other medical emergency, that once we take the patient to the hospital, we should drop a pack for them to take care of this patient till the relative comes around. Nobody does that around there. No state, no country in West Africa does that. That when you take a patient, an ambulance take a patient to the hospital, you still take care of the patient till the time that the relative or friends comes around to take over the management. No, nobody does that. It's the kind of effective ambulance system that we now have in Osun State. It's a big deal that you won't find it anywhere. You won't find it anywhere. Lagos has ambulance services, but we are more effective because road traffic will not allow them to be as effective as we are. Ogun State just started their own. Some of other states are coming to copy Osun State. In emergency services in Nigeria today, Osun is a state to beat. That is how well this administration has done for the emergency. Once you step your foot into the boundary of Osun State like this, you are secure. If anything happens to you, you can be rest assured that within 5 to 10 minutes, an ambulance is there to attend to you. We have taken delivery of several babies in the ambulances. We have qualified, well-trained paramedics that are working with us. We are in collaboration with Osun Teaching Hospital, Federal Road Safety Corps, and so many other private agencies that help us to train our drivers and our paramedics, thereby delivering optimal and efficient services to the people of Osun State. All this couldn't have been, possible if not for the support of this administration. Mr. Governor has been, when you look at his plan, his manifesto, you see that health is a major pillar of his manifesto, and he's doing so diligently well. Funding health, going around, making life better for the people of the state. My name is Olusegun Samuel Babatunde. I'm the General Manager of Osun Ambulance Services Agency.